A school opening this year in the Brazos Valley is working to help students with learning disabilities be successful and confident in order to thrive. We'll have more. And it's the final week of our Feed the Need food drive. We'll tell you how you can help. Your Krhd News starts right now.
Connecting the Brazos Valley. This is Krhd News.
Good evening and thank you for joining us. I'm Hallie Jones. Students with dyslexia or a similar learning disability may find it difficult to learn in the public school system. Krhd reporter Rachel Espayat shows us one College Station school is helping to change that while giving students with dyslexia an opportunity to thrive.
Jill asked.
When Tara Hott, who has dyslexia, started going to Happy Camper School last year,
It will be the best if.
She was at a first grader reading level.
But by the end of last year, she went from first grade to a fifth grade reading level, which she is in fifth grade now.
The school boosted Tara Hott's reading skills and confidence.
Every day whenever I go to public school, I feel very nervous to go because I feel like I'm going to fail a test or something. Mm-hmm. But whenever I go to Happy Camper School, I feel like I'm going to get 100. She spots Lynn, Beth.
Now she even finds reading enjoyable.
I like that I learn from reading, but I don't notice it, so I'm also having a good time as well.
Ross Gunnell saw a similar transformation when his son started working with the founder of the school.
When he worked with Kristen and he got that confidence and really made progress reading, it was kind of revolutionary for us.
Kristen Pitts is her passion to help students with dyslexia started in her first year of teaching. One of her students was repeating the first grade.
I felt like he was this really smart kid. He understood jokes that his classmates didn't get. He had like this brilliant sense of humor, and yet he couldn't read. And
finding out her two daughters also have dyslexia inspired her to open the school to help even more students turn a new page in their lives.
All kids want to learn how to read books that are interesting to them, but kids with dyslexia have a little bit more of a challenge because they need to find these interesting books that are also decodable. This book in my hand is an example of one that makes it easier and provides that support.
So with these books, we are actually teaching them to rely on the decoding strategies that they've been taught. So if they've learned closed syllables, for example, they know that the A with that consonant after it's going to say the ah sound, and it's consistent and reliable.
These books come at a hefty price along with other school costs, putting the tuition at $12,000 per student. Hott is trying to offset the cost by launching her nonprofit Brazos Valley Dyslexia League and asking donors to sponsor a student. In College Station, Rachel Espayat, Krhd News.
So what else is being done to help dyslexic students in Texas? According to the TEA, House Bill 1264, which was passed before the 2013-2014 school year, requires schools to report the number of dyslexic students in the school district. This is done through the Public Education Information Management System. Starting in the 2019-2020 school year, schools were allotted extra funds to help students with dyslexia. Researchers at Texas A&M School of Public Health have utilized an inexpensive and convenient tool to utilize in their air quality studies. Silicone wristbands were placed on pregnant women to screen for exposure to chemicals that are harmful during pregnancy. The wristbands absorb particles of the polycyclic aromatic hydrocarbons, which is a chemical produced when coal and oil and gas are burned. Studies show when inhaled over long periods of time, the chemical is linked to cause childhood asthma.
These bracelets were effective at sorbing chemicals and helping us determine what exposure women had in this study. So we do see potential for use in future health studies. So in this case, we didn't follow kids out to see what the chance of them developing asthma was, but these could be readily applied in future studies.
The wristbands can also be used for qualitative air and human exposure studies to detect chemicals such as pesticides. Tonight, we're investigating the Texas housing shortage that's causing some cities to take action. KRHD investigator Dennis Turner shows us how it's especially affecting the apartment market.
Haley Maynard calls apartment living a great way to start out on your own.
For me personally, I just needed the one bedroom and it was great. It was just enough for just me, but still big enough for me to feel like I was at home.
But as the market for single-family homes has tightened in many parts of Texas due to the state's popularity, the same problem has spilled over to apartments. In Waco, the problem has gotten so bad, those turned away at apartments with no room have turned to hotels.
We went to probably about 10 apartments, and they all said earliest they can move us in is in September, so which was insane.
Yet another reason Waco has commissioned a study of its housing problem, its causes, and possible fixes.
And we want to do that to make sure that we are addressing this housing crisis, because it goes back to this, it's the housing shortage that we have. We want to make sure we're addressing this appropriately and correctly.
The mayor says he expects hard data to yield positive change.
As we have this housing study come out this fall, that I would like tried and true strategies based on data for us to be able to evaluate at that time. I think that these are some of the things.
And it comes not a moment too soon, because when you have a shortage of anything, prices go through the roof. The median rent price in Texas in 2019, $1,091. That's $6 less than the national median, but the highest Texans have paid since the ACS survey started about 20 years ago. Our homeowners, Tony and Lynn Wagle, say Waco doesn't have enough variety in housing.
Yeah. You know what they don't have in Waco is quality apartments, although that's coming up now, even so. Apartments.
Maynard says apartment living has lots of advantages.
I feel like the advantage to apartment living is definitely gives you a sense of community, so you still have like that close-knit group of people that you can count on, but still being out on your own away from your family and still being well affordable.
Plus, someone else fixes everything and cuts the grass. And while she still thinks of apartments as starter homes, she knows many who have taken to the life and love it. Do you think that all apartment dwellers aspire to be homeowners?
I don't think all of them do now. I think some of them get pretty comfortable and tend to stay. Yeah.
And with waiting lists to get in one of these units, she says staying put doesn't sound like that bad an option. In Harker Heights, Dennis Turner, 25 News.
Well, only 4 more days remain in KRHD's Feed the Need food drive to benefit the Brazos Valley Food Bank. KRHD reporter Rebecca Fiedler walks us through the food bank to discuss how donations can help this community.
Though much of Texas has reopened since the onset of the pandemic, the Brazos Valley Food Bank still relies on drives like Feed the Need and on volunteers like these. KRHD's Feed the Need drive will benefit the Brazos Valley Food Bank this summer. A total of nearly $6,000 has been raised so far, which will be distributed to organizations through KRHD and our sister station in Waco. The challenges of the ongoing pandemic have made the need for charitable efforts even more crucial, as many Brazos Valley residents are still suffering from food insecurity.
We know ahead of time we're going to get certain items, but it's not going to meet everybody's needs or everybody's variety that they want. So if we can make up that variety and donations from the public and retail pickup, we absolutely want to.
Money can be used to fund programs such as the food bank's Together We Grow Garden, which teaches employment skills to clients and acts as a source of fresh produce for distribution. Every dollar given to the food bank is enough to cover 2 meals. As the food bank is continuing to recover from a major food deficit at the crux of the pandemic, every meal is meaningful. Helping one donation at a time at the Brazos Valley Food Bank, Rebecca Fiedler, KRHD News.
The number of people buying life insurance in the first part of this year is the highest it's been in nearly 40 years. LIMRA, a research organization for insurance companies, tells us these increased sales could be what happens for the next few years. Now, after the Spanish flu pandemic, they say that life insurance sales went up pretty steadily for about 4 years. Company CEO thinks that we could see that trend as well right now. And he says that Black Americans are seeking out life insurance at higher rates than other racial groups. And a recent study from LIMRA finds 56% of Black Americans now own life insurance, which is up 3% from 2020, and it's 4% higher than the rest of the population. The study found that Black Americans report a higher level of financial concern, and COVID-19 made these concerns worse.
when we look at things like, the mortality rate, when we think about things like the infection rate, it was just disproportionately high in the Black community in this country.
Nearly 60% of Black Americans in the study say they plan to buy life insurance in the next year. That is compared to 36% of the rest of the population. But Black Americans are also more likely to overestimate the cost.
If you took a 30-year-old, a healthy 30-year-old, and they purchased a $250,000 term policy, that might cost anywhere from $150 to $200 a year. But people overestimate that cost, and people are saying that if I had to guess, it would be 5 times what it truly is.
The main reason Black Americans think insurance is needed is only to cover funeral costs. Limra's CEO says that perception could mean they don't end up buying enough coverage for income replacement to help after a loved one dies.
First Alert Chief Meteorologist Matt Hines is standing by with a look at weather.
And as we look out over Bryan College Station, we are looking pretty nice if you don't mind it being a little hot out there. Partly cloudy skies on our Extraco Eagle Eye right now. There's the A&M campus in the background, 94 degrees, partly cloudy, feeling like 100. Winds are calm, so with not much of a breeze, it is really hot when you start to step outside, and you don't even get that to blow across your skin. Clouds and radar not showing too much around here, as we have seen some more cloud cover for today. Most of the activity, though, rain-wise, has been well off to our east across portions of Louisiana. But this is a weak storm system which will slide back to the west here over the next 24 hours. And it could bring us at least isolated thunderstorm chances as we make our way into the next couple of days. So here we go. As we get into tomorrow morning, partly cloudy skies, not much happening. We got to get the heating in the atmosphere going, and we may see a couple of isolated to widely scattered thunderstorms by 5 o'clock on Wednesday. Then we get to Thursday, partly cloudy skies in the morning, isolated thunderstorms possible into the afternoon. And again, rain chances only 20 to 30%. So not everyone's going to see the rain, but at least there's a little chance out there. Temperatures will be in the mid to upper 70s for tonight. We'll go 78 in Hearn and Bryan College Station down to Navasota. And tomorrow, highs in the mid 90s. So with the increased cloud cover and that slight chance of rain, we may see temperatures come down a couple of degrees, which that's not a bad thing, as humidity values will still make it feel like it's near 100. And as we check out your forecast, those temperatures will be coming up as we get closer to the weekend. There's your isolated storm chances for the rest of the week. Weekend looks dry, but next week could bring some changes, maybe some slightly cooler temperatures and some more rain chances.
Traumatic brain injuries are usually associated with athletes, but there's another population that, according to research, is even more impacted. We're talking about the prison population. Researchers say TBIs impact decision-making and impulse control, which can lead to people to reoffend. Vanessa Mashania talked with 2 former inmates who made it their mission to fight recidivism by informing others about these injuries.
Markel Taylor Bay has made mistakes.
I was always snappy, agitated, impulsive.
While serving a 21-year sentence for robbery, he wanted to put those mistakes in his past. He educated himself about business, found a business partner, and when he got out, they got to work, but he soon found himself back inside.
36 days later, after doing 21 years of incarceration, I went and robbed a Papa John's Pizza. My brain just shut down, and people was wondering how, after doing all of this time, having the business education he have.
While he takes ownership of his actions, Markel learned about ongoing research from the University of Denver that suggests he was also a prisoner of his own mind.
Didn't know I had a traumatic brain injury. I didn't even know I had mental health issues.
The CDC defines a traumatic brain injury, or TBI, as an injury that can affect how the brain works. Caused by a blow to the head, it's a major cause of disability. New findings by researchers estimate that 50 to 80% of America's prison population has had a TBI. Outside of prison, less than 9% of the general population has had a traumatic brain injury. The statistics are worse for incarcerated women. 97% have had a traumatic brain injury, and half have had multiple. The results of this groundbreaking research was shocking to the study's author, Dr. Kim Gorgans, who has been speaking out since, including in this TED Talk, which she provided to us.
In this way, these women's brains look like the brains of retired NFL players. and they'll likely face the same risks for dementing diseases as they age.
Dr. Kim Gorgon's research has shown that TBIs can impact someone's ability for self-regulation, judgment, reasoning, and problem solving. And that, she says, can lead inmates to reoffend once they get out of jail.
You know, trauma is the only thing that we let get to a stage 4, you know, before we start to treat it. And the treatment is prison.
Corey Shively met Markel in prison and is now his business partner at their marketing company. Thanks to the study, they both discovered TBIs they suffered while they were younger have impacted their judgment and impulse control and are now getting help for it. They've now made it their mission to educate their communities about traumatic brain injuries.
We should have better resources in our community to be able to deal with this trauma up front. We shouldn't have to wait till Markel's 47 and I'm 40 years old for us to get some therapy.
They've taken their mission to the Colorado state capitol with hopes of changing policy across the nation. They helped create a new law that mandates neuropsychological exams for inmates once they get sentenced. If a mental illness or brain injury is detected, psychologists make 2 plans, one for prison staff to manage the inmate and the other for the inmate on how they can better themselves, all with the hope of reducing recidivism.
They're going to be able to see what's going on with their brain, become more aware, and, you know, like we like to say, trauma-informed, trauma-conscious, trauma-responsive.
Markel hopes that this is just the first step in helping people like himself recognize their own disability to make themselves and everyone around them safer.
We're here to help this state be returned back to a baseline state of safety so people can operate effectively and they don't have to suffer in silence.
I'm Vanessa Mishanya reporting.
Finally in our lineup, the vaccination rate among doctors is high, but it's not the same story for other healthcare workers. The new high-profile push to require the vaccine. Momentum is growing for mandatory COVID-19 vaccines. The Department of Veterans Affairs now says that frontline healthcare workers need to get the shots within the next 2 months or they may be fired. New York City and the state of California are telling government workers to get vaccinated or face weekly testing. And there's also a push from a unified voice of nearly 60 healthcare associations saying the healthcare community should lead the way in requiring vaccines for all employees.
And to get this pandemic behind us, we need to get as many people vaccinated as quickly as possible. And unfortunately, it's come down to talking about mandates.
The American Medical Association is one of the groups supporting vaccine mandates for healthcare workers. Now, it's not an uncommon requirement. Healthcare institutions require workers be vaccinated against other diseases. More than 96% of physicians are vaccinated, according to the AMA, but the numbers aren't nearly as high for other healthcare workers.
I'm afraid they've been exposed to misinformation and disinformation, just like everyone else.
We thought it was important for us as a healthcare community to say it's mandatory for all of us to take vaccine. There's overwhelming science to support its safety.
Both healthcare organizations stress there is an ethical and moral responsibility for healthcare workers to be protected and protect others from infectious diseases. Dr. George Abraham with the American College of Physicians says many organizations were waiting for a unified voice on vaccines from the scientific community.
The statement applies to healthcare workers for now. We are not saying it is across the board for everyone in the public, but the message is clear that if we don't take a stance, then no one else is going to follow.
Drug and alcohol treatment counselors say they are becoming increasingly concerned about addiction numbers rising. Tomorrow, what they say needs to be done to prevent numbers from spiking amid new talk about restrictions, even involving those who are vaccinated.
Well, here are the stories we're working on for Krhd News at 6. Hundreds of the nation's firefighters are in College Station training at Teaks Fire School. But what economical impact does this have on our area? Plus, if you're looking to move into a new home or an apartment, you probably found it difficult to find something affordable or at all. These stories and more coming up at the top of the hour. World News Tonight is just ahead, and we're back in 30 minutes for Krhd News at 6. Until then, have a good